All right, so Bremelanotide or VitaPro is something that we use in the office, and this is undergoing significant research for the study of the possible use of this peptide in providing relief from sexual dysfunction for both women and in men. Uh, this is a peptide that actually stimulates the uh, melatonin uh, receptor in the brain. It was initially thought that they could use it to allow people to tan without being exposed to the sun. It didn't work very well for that, but it did help with erectile dysfunction in men, and it seemed to help with sexual arousal in women. There is a company now that is going through FDA trials to have this as an actual drug, but since it is a natural peptide that has a natural receptor in the body, it has kind of been used for research purposes, but as physicians, we can get it, and we can sell it to patients, and we can also have other doctors use it. But this works differently from Viagra and some of the other uh, drugs used for erectile dysfunction. It works more in the central nervous system because there's three things that have to go along with sexual arousal in men and in women. There is the hormonal piece of it, and I believe that it's more estrogen progesterone balance in women than it is in testosterone. I don't really think the testosterone helps a lot with women in libido. It helps with, if you put it topically, uh, it helps with sensitivity of the clitoris, but it really doesn't help with desire. Uh, and then there's also the blood flow problem. In menopause, women seem to have less blood flow to the vagina and the clitoris, so it's less sensitive. And then there's the nervous system problem. And with women, sex is more of a mental thing. With men, it's more of a mechanical type thing. But the bremelanotide works with both of these because the man has to have the nervous system be in a parasympathetic mode so that the nerves can relax to open up the blood vessels. And then the actual blood vessels have to be clear of any plaque or any damage so that blood flow can go through. So the Viagra opens up the blood vessels, keeps them clean, but the nervous system is also involved in allowing an erection to happen. So this seems to work with both men and women. So I've been using this in the office. I've had a positive response from men and a positive response from women, and probably a greater response in women than I have in men. This is an injection. They initially started using this as a nasal solution, and the problem was it was increasing blood pressure. So now it's a sub-Q injection. You actually put 0.2 cc's. You can go from 0.2 to zero point 0.4 cc's, and you inject it in the abdominal fat with the insulin syringe. You dilute it in bacteriostatic water, and it works very well. My women patients probably get more of a benefit from it than the men. I see men with erectile dysfunction, and a lot of them are at a point where there's serious problems. So it has worked in them, but a lot of my perimenopausal and menopausal women are very excited about this bremelanotide, and we call it VitaPro. I've looked around at different places where we can purchase this. We get it from a place that's 99% pure. It has been around for a long time. They understand all the ins and outs of it. So we get it from a very reputable peptide company. Let me show you the VitaPro on our website. So this is the VitaPro bottle. It has 10 treatments. If you're using 0.2 cc's, it has 10 treatments in it. It's $75 when you order it. We reconstitute it for you because it comes in a powder. It does need to be, it's best if you refrigerate it once you receive it to store it in the refrigerator. It seems to have a little longer half-life if you do that. And we give you the syringes. We give you the alcohol pads, and we also give you instructions on how to administer it. And I'm probably going to create a video to really show people how to do it. All of this is available to my physicians at Wholesale, you know how to log in and get the price if you're going to provide it for your patients. But this is very promising. Let me show you the studies on that. You can look it up yourself, but here's the bremelanotide. And again, I'm going to give you a link to all of this. Bremelanotide for female sexual dysfunction in premenopausal women, a randomized placebo-controlled dose-finding trial. All of these are talking about, and then I want to show you the salvage of sildenafil failures with bremelanotide. So this is a double-blind study to show that people who didn't respond to sildenafil or Viagra did respond to bremelanotide. The reason why is, again, it works on two different systems. The sildenafil is looking more at opening up blood vessels, increasing nitric oxide, and this is more of a central nervous system, has more of a central nervous system effect. So again, I'll give you the link to all of these so you can look these up for yourself, but this is a new product that we have at Tail MB Formulations.